Good afternoon, everybody. I am thankful to Dr. Lalit Verma to give me the opportunity to interact with you. We are all here in this session, which is a very right way to address our situation and problems and how to look after our patients. That is our primary job, to look after patients. And we'll be talking, again, there are very good speakers here. We'll give you tips and clues about how to handle your patients well, how to make them happy, how to make them aware of their rights. Everything is there. I'm going from the other side. In fact, I'm going to spoil the party. So we have Hippocratic oath. We are bound by certain our duties, our commitments, everything that doctors have been told from day one. Doctors are known as God, supposed to be known as God. I don't know where we stand now. It's again supposed to be a noble profession. We are the noble gentlemen. We should always behave well. We should not lose our temper. We should not misbehave. That is our primary job. You can get a request, doctor, please do your best, even in spite of telling that is beyond your means, your capabilities, or the situation doesn't warrant that you can handle this case, but still you will be asked, and many times we get tempted and carried away by the request and do land up in a situation when everything reverses after something goes wrong in that case. It's a changing time and we have to change with time. Definitely you change your attitude. You have to be absolutely professional when you are dealing with a situation, any situation, even routine cases or a difficult case, doesn't matter. And you are no longer a holy cow. Your patient don't take you at your word, that you can be very sure. If they're always in doubt, whenever you advise surgery, they always go for a second opinion to confirm whether the advice is correct or not. In fact, we have become a whipping boy in the society. A complication from medical perspective is always negligence from the patient's point of view. That we have to accept it now. That is how the patient looks at it. And the ultimate evaluation is not done by a medical board, but the court of law. And court, besides evaluating legally, also starts taking a very sympathetic attitude towards the aggrieved party, which always happens to the patient. Coming to the difference between the medical and legal profession that we have to understand. We work on trust. What we talk, what the patient tells us, we believe them. When we talk to them, they are supposed to believe us. The law works on a very different ground, with different perspective altogether. They totally work on distrust. So I will just give you an example. Suppose in record keeping, if there's any override, unintentional I'm talking, any deviation, different dates on the same page, lack of entry time, they are all taken as tampering of records by the court of law. That you must understand and be very careful while you're documenting your records, even in routine cases. Judges, we cannot blame the judges because the system is almost fallacious. There is no provision of advisory jury in our Indian legal system. They are not bound or are supposed to seek medical advice. Treatment, we all know, is a journey that we undertake with our patients. We both travel together from the day we examine the patient, we carry out the surgery, post-op follow-up, till the date when we have a final follow-up and tell them, okay, you are fine. And we have to travel together, behave in a way that everybody else expects to be behaved. We are talking about the patient's right. What about your right? We always talk about their right. I think there is a talk by none other than Samir Sood. You are talking to the patient. You are talking to
change the topic.
Okay, you change the topic. Good. Surgical procedure. We all know that Sita had only one Agni Parikshak. A surgeon crosses fire every time. We all know when we perform a surgery, what things we go in our heart, when the things go wrong, how the heartbeats misses, how the blood pressure goes up, everything. We have to go through this trauma of pressure every surgical procedure that we take. And when complications occur, you lose your sleep, you lose your appetite, you lose your peace of mind. So what should be the patient attitude when you land up in a complication, which you have not done intentionally? It happens. There will be no complication-free medical services, at least for next 50 to 100 years. I can see that. Maybe when the robotics come 100%, maybe, but it's still not possible. Should he shout at us? Should he threaten you to take you to the court or resort to physical violence, which of course the newses are very prevalent these days, you can see in the newspapers. And court of law, I can tell you, only understands documentation. There is no place for emotion or compassion. Many times patients tell you, cut down the cost, you cut on consumables, you cut on investigations, But if the case goes to the court of law, the court is not going to accept any of these excuses. Why did you not carry out? Because you wanted to cut the cost. And I can tell you 100% the patient will be totally giving absolutely other version there in the court of law. And so there's nothing like helping attitude. You should be totally professional, put the things across as it is. Patient goes away, doesn't matter. I can tell you can survive bad surgeries, but you can't survive a bad documentation. So protect yourself by good, methodical, continuous documentation. Coming to legal help, you must have a lawyer in your good book. You must have a relationship with a lawyer, professional. I'm not talking about a friendship with the lawyer. It's something like a family physician. These days you must have a family sort of lawyer. Because a honest lawyer is very important. There is a difference when we take up the case and we land up in a complication, we are liable. A lawyer even loses the case, he has no liability. So no lawyer will ever normally refuse a case. So you have to be careful that he gives you or she gives you an honest opinion about your case, where do you stand in this situation. And try to avoid going to the court. It's a big trauma, I can tell you that. And an honest lawyer is of great help. So we all know this dialogue. We are not here to make friends. We are professionals. We will treat our patients in an absolutely professional manner. Thank you very much for your kind attention.
Thank you, Dr. Jha.